Itching anal. Anal itching is a skin disorder that produces itching in the anal area, which grows worse at night and after a bowel movement. It affects 1% to 5% of the population, indicating that it is widespread. Rubbing the anal area to get rid of the uncomfortable feeling is not a good idea because it will cause scratches in the area, which will lead to infections and ulcers. The area is an excellent environment for some types of pollutants, and the rubbed hand will come out laden with many pathological pollutants. Anal itching has a variety of causes, with 75% of instances being caused by one of the factors listed below, and 25% of cases being categorized as having anal irritation of unknown cause. Anal itching types. Anal itchiness can be divided into two types. 1. Anal itchiness, primary. This ailment has no identifiable major source, and the itching appears, disappears, and reappears without any knowledge of its reasons. 2. Anal secondary itching. This form of itching can be caused by a variety of factors, which the treating physician can identify and treat with the appropriate drugs. Symptoms of anal itching. The major symptom of anal itching is a feeling of bothersome and urgent itching in the anal area, but this symptom can often be accompanied by other symptoms, including 1. General anal itching symptoms. The following are the general symptoms of anal itching. The color of the skin. Pain due to irritation of the region. The skin around the anus peels. 2. Anal itching symptoms that necessitate medical attention. Not every incidence of anal itching necessitates a trip to the doctor. Most cases last only a few minutes, but if the following symptoms develop, you should see a doctor. Severe anal irritation that persists for long periods of time. Bleeding from the anus or the skin surrounding it. Leakage of feces. Blisters surrounding the anus, which are occasionally filled with pus. Anal itching causes and risk factors. Let us know the reasons of anal itching and the factors that enhance the risk of infection in the following. 1. What causes anal itching? The following are the most common reasons of anal itching. Clean the anal area thoroughly. Some people clean the region with harsh perfumed items, which causes irritation, and over-drying the area with toilet paper can also create itching. There is feces or sweat on the surface. The existence of a big amount of feces outside the anus and failure to clear it produces itching, as well as numerous severe irritations and exfoliation in the area, and this may occur more frequently in youngsters who are just learning to rely on themselves to go to the bathroom. Excessive sweating is a typical cause of anal itching, especially in persons who gain weight, although this is a temporary reason that goes away once the area is cleansed. Anal, colon, and rectal problems. Anal itching can be caused by a variety of conditions, the most common of which are rectal prolapse, for example. 2. Hemorrhoids, either internal or external. Anal fissures. Number 3. Fistulas are a type of fistula. The majority of the time, severe diarrhea or constipation causes anal irritation. Bacterial infections. Many fungal, bacterial, and viral infections can impact the area, causing a variety of skin disorders, including anal itching. The following are some of the most common causes of infections. Staphylococcus aureus, staph. Bacteria Streptococcus pyogenes. Candida albicans, a fungus. Pinworms. Number 4, Enterobius vermicularis. Some skin illnesses that develop throughout the body can reach the anus, generating a variety of symptoms, including itching. Some of these diseases include psoriasis, for example. 2. Dermatitis from contact. 3. Dermatitis atopic. Psychiatric illnesses. Anal itching is commonly caused by psychological illnesses such as stress and anxiety. Systemic conditions. The following were the diseases. 1. Diabetic coma. Leukemia is number 2. 3. Leukemia. 4. Thyroid problems. 5. Kidney failure. 6. Liver failure. 2. Factors that raise the risk of having anal itching. The following were the factors. Your age. Anal itching is more common in adults between the ages of 40 and 60 than in others. The gender. Men are 4 times more likely than women to have anal itching, which could be attributed to the makeup of their bodies. Unlike women, who have less hair in that area and frequently remove hair, the area is covered in hair. Complications of anal itching. Anal itchiness might cause the following complications. Scratching the region, resulting in septic ulcers. Disease transmission from the anus to other regions of the body if the hands are not thoroughly cleansed after rubbing. Disease transmission from the anus to other individuals, in the event that food is contaminated with anal contaminants by dirty hands, and this multiplier has spread across restaurants, causing food poisoning in a significant number of people. Anal irritation is diagnosed. Anal irritation can be identified in several ways. 1. Clinical assessment. The doctor examines the region at the bedside to check if there are any odd changes. If the doctor notices visible hemorrhoids or skin problems like psoriasis or acne, he may determine the cause directly. In the absence of a visible explanation for the ailment, the doctor gathers all of the patient's information about his health and any other illnesses he may be suffering from. The physical disease may be linked to this problem, according to the expert. 2. The endoscope. If the itching is severe and the doctor cannot figure out what is causing it clinically, he recommends an endoscopy, which shows the state of the rectum and anus and diagnoses any hemorrhoids, fistulas, or anal fissures. 3. In-depth investigations. If no diseases are identified in the rectum or anus, the doctor will refer you to a full medical examination to figure out what is wrong. The following are examples of these tests. A complete blood test. Stool examination. Examination of the urine. X-ray examinations. Bacterial examinations, which are frequently performed using an anal swab culture. Itching relief anal. One of the following procedures is used to alleviate anal itching. 1. Medication applied topically. Creams containing 1% hydrocortisone reduce itching and irritation, and your doctor may advise you to apply them 2 to 3 times each day. 2. Oral medication. If the cause of anal itching is bacterial, viral, fungal, or worms, oral medicines may be used. The doctor prescribes antibiotics for each type for a specified amount of time, and the patient must follow the doctor's instructions exactly. 3. Treatment with injections. If the itching is severe and previous therapies have failed, methylene blue injections are utilized. The skin around the anus is injected with these needles. Anal itching prevention. In some circumstances, anal itching can be avoided by following these guidelines. Avoid rubbing the area vigorously with scented items, and only use a medical product designated for this area twice a week. After vigorously cleaning the area, do not dry it. Applying moisturizing ointments to the affected area on a regular basis. Clean the region from the stool with water rather than wipes, as this occurs frequently while changing the baby's diaper, and the mother wipes the area with wet wipes rather than washing it, causing the baby itching and irritation. As soon as anal disorders such as hemorrhoids and anal fissures are found, they must be treated. If the itching is caused by heavy sweating, wash the area with warm water. Wear cotton underwear and change it every 3 months.